How does your spleen increase sickle cell infection risk? Imagine your spleen as a tiny but mighty filter in your body that helps catch germs and keep you healthy. In sickle cell disease, this filter gets damaged over time because of the abnormal shape of red blood cells. These sickle-shaped cells tend to get stuck and cause repeated injuries inside the spleen. This damage leads to a condition called functional asplenia, which means the spleen no longer works properly. When the spleen can't do its job, it becomes much harder for your body to fight off certain infections. The problem is especially serious because the spleen normally helps clear bacteria from your blood, especially bacteria with shells called capsules. These include bacteria like Streptococcus pneumoniae, Haemophilus influenzae, and Neisseria meningitidis. Without a healthy spleen, these bacteria can multiply easily and cause serious infections that can become life-threatening if not caught early. This is why people with sickle cell disease are at a higher risk for invasive bacterial infections. In children with sickle cell disease, the damage to the spleen can happen early and often without obvious symptoms. Sometimes, large amounts of sickled cells get trapped suddenly in the spleen, causing it to enlarge quickly. This is called splenic sequestration and can lead to severe anemia and low blood volume, which is a medical emergency. But even outside these emergencies, the ongoing damage from sickled cells makes the spleen less able to do its job of filtering bacteria, leaving the person more vulnerable to infections. Because of this increased risk, infection prevention becomes a vital part of managing sickle cell disease. Doctors often recommend daily antibiotics, like penicillin, especially for young children, to help prevent bacterial infections. Vaccinations are also very important. They protect against the most common bacteria that can cause serious illness. Regular checkups to monitor spleen size and function help catch problems early and keep infections at bay. In summary, the damage caused by sickled red blood cells leads to the spleen losing its ability to filter bacteria effectively. This functional loss makes individuals with sickle cell disease more prone to dangerous infections. Protecting against these infections through vaccines, antibiotics, and regular medical care is essential to living well with sickle cell disease. Always talk to your healthcare provider for personalized advice and the best ways to stay healthy.